April is Foot and Ankle Awareness Month, and as the days get longer and weather gets nicer, people of the Treasure Valley, we're getting outdoors, which means more time outside, and that means more chances for slips, trips, and orthopedic injuries. So we have orthopedic surgeon Dr. Lauren Black joining us today to share the best preventative tips for slips, trips, and falls this season, along with ways to be and stay active during the spring and summer trauma months ahead. A warm welcome to you. Thank you for joining us. Okay, so I would like to know up front, what is the difference between orthopedic trauma surgery? How is it different from general orthopedic care?
So, orthopedics is a big field and encompasses the care of the musculoskeletal system. Orthopedic trauma specifically is fracture care predominantly. So people who have fractures, whether that's operative injuries that require a surgery or whether that's non-operative injuries that can be treated without surgery. But regardless, in all events, orthopedic trauma's zone of specialty really is fracture care.
Tell us about your experience when it comes to treating those complex fractures and also those musculoskeletal injuries.
Sure. Orthopedic trauma surgeons, as I just described, all of us, what differentiates us from the general orthopedics community is additional training specifically in trauma and treating especially the complex, what we call periarticular, or fractures that involve or are right near a joint. Those can be a little bit more difficult and they require special techniques. And so we all have additional training and then years of clinical practice in treating those complex injuries. Other things that differentiate orthopedic trauma from general orthopedic care involves what parts of the body we feel comfortable treating, in particular the pelvis or the hip socket. Those are very complicated geometric spaces with lots of internal organs that are nearby and are also often associated with other non-orthopedic injuries, belly injuries or brain injuries or chest injuries. And so we have extra training that the average orthopedic surgeons don't get in how to manage those injuries.
I would love to know, how do you determine the best treatment plan after a fall?
Well, it depends on what happened in the fall. One of the beauties of our work is that it's different for every patient, and there is no single answer to that question. Even if the fractures were exactly the same, which they seldom, if ever, are, the people are different and the goals are different, and so the plan is designed for that patient to recover in the ways that they need to. I took care of a patient not that long ago who simply had to get back to work or he was going to not be able to take care of his family. And so we did a slightly bigger surgery up front with the goal of getting him back to walking faster, whereas somebody who could afford to take a little bit more time and recover, we might do a slightly smaller surgery for that person with that same injury.
What are some other ways we can reduce our risk of falling?
Sure, the two things I would say are regular weight-bearing exercise and making sure that you have enough calcium and vitamin D intake. And those are things that I would recommend people talk with their primary care physician about, whether and how to supplement and so forth. Okay,
so a really great focus on bone health.
Yes.
Why should somebody choose St. Alphonsus Orthopedic Trauma and Fracture Care?
At St. Al's, we have the ability to care for not just orthopedic complex injuries, but in patients who have multi-system injuries. I kind of described earlier, the kinds of things that happen if a patient not just falls, but maybe gets hit by a car or a train or something serious like that. And we have at St. Al's the ability to care for all of those kinds of injuries, not just orthopedics, but also non-orthopedics care. That's reason number one. The other reason is that because we have that degree of comfort and flexibility with all of the range of complexity and variety that happens in fracture care, even when it is a more simple injury, a sort of more run-of-the-mill type fracture, we still are the highest standard of care in my field for taking care of those injuries.
That's fantastic. I want to talk about preventing slips and falls, right? Especially when it comes to an aging senior patient. Give some advice. What are some ways to be proactive to avoid injury?
Yeah, please. If you can, stay away from orthopedic trauma surgeons, please do. To prevent falls, making sure that there are no rugs at the bottom of your stairs that move around. If you have pets and they leave toys everywhere, those are the things that we trip over in the middle of the night. I meet somebody almost every day who falls off of a ladder. And so just being aware that these things are dangerous, and that even though they're in our homes and they become, just like the wallpaper in our homes, they sort of blend in and we don't see them. They are potential sources of danger, and they should be dealt with thoughtfully.
So reducing risk, and I imagine too finding ways to stay strong muscularly, right? So some simple workouts, staying active, all great opportunities to avoid, like you said. If we have to come see you, we're glad that you're available and that you're here for us, but like you'd mentioned, the best solution is prevention. Right? Okay, so where can people go so they can learn more, not only about St. Al's and the incredible care that you offer, but maybe some more information?
Sure. The two places I would refer people are stalphonsus.org, and the other one is the American Academy of Orthopedic Surgeons. That's the group of people trained such as myself, and their website is orthoinfo.org. So stalphonsus.org and orthoinfo.org.